Good day. This is Doc Gigs. So we are now in chapter 4, the conceptual phase. So our learning objectives for today is first develop and articulate problems, statements and purpose statements. Second is relate the steps of systematic search strategy for a research problem. Third is recognize the different sources and types of literature. Fourth is reflect on the ways that the research literature can be used as evidence of nursing practice. Fifth is evaluate the identifying characteristic of theoretical and conceptual framework. And last, to develop theoretical and conceptual framework and formulate appropriate hypotheses as necessary. So, this presentation is by our very own Dr. Bel Magnaye. So let's review the comparison of quantitative and qualitative research. So we have quantitative research is more on analysis, more on having solved the problem itself, structured and procedures, formal instrument to collect information. It is objectively done, analyze numeric information through statistical procedure. On the other hand, the qualitative research attempts to understand the entire of some phenomenon. Its few preconceived ideas, stresses importance of people interpretation, does not attempt to control the context of the research. It attempts to capitalize on subjective data. It analyzes through narrative information, but intuitive in fashion. In a quantitative term, person contributing information is the studied participants in the subject. It's also the same as in the qualitative research. Person undertaking the study, research as investigator, it's also the same. Information gathered, it's data, it's numerical values in quantitative. However, in qualitative research, it's more on the narrative description. The links between concepts, there's relationships in quantitative, it's more causal and functional. In qualitative term, it's more on the pattern of association and logical reasoning process, deductive and inductive. Now, deductive is from general to specific. Inductive is from specific to general. Now, quality of evidence is reliability, validity, and generalizability. And for the qualitative research is trustworthiness. So, let's proceed. So, the 5 major steps of quantitative research based on Pollitt and Beck is first is conceptual phase, design and planning phase, empirical phase, analytical phase, and last is dissemination phase. So let's see first in the conceptual phase. In conceptual phase, there's sub steps, no? The formulation and delimiting the problem, review of related literature, undertaking clinical fieldwork, defining framework, developing conceptual definition, and last is formulating a hypothesis. In the conceptual phase, first is formulating and delimiting the problem. You should identify an interesting research problem and formulate a research question. Selection of research problem is the most difficult step in research process. Sources of research problem may be from policies or programs, interpersonal relationship, organizational structure, etc. Such as now, in the time of pandemic, there's a lot of research regarding COVID-related subjects, such as the mental health of an individual. What are the physiologic changes experienced by a COVID patient? What are the stigma and discrimination experienced by our healthcare providers or even the patient him or herself? So you should have a defined title, no? And a research problem and a research question. Research problem is a troubling condition that an investigator wants to solve. So for you as an investigator, as a researcher, you should be clear enough. What do you want? What are the questions lingering in your mind? No? What are the questions that are not answered yet? So that's the very essence of research, no? Answering the problem or solving a dilemma. Next is research question. Is a specific queries or question that research wants to answer by study, such as in the COVID-related research. Are there depression in the course of COVID disease progression? Are there acceptance? Is Kubler-Ross DABDA process are the same with the COVID pandemic or the COVID patient? Are are this the same? So there's the research question. And last is the statement of the problem. The statement of the problem, explicit and precise expression of the dilemma or the research question to address that indicates understanding and direction. Okay? These are the elements of a research problem. First, ask this to yourself. What's your purpose? Why? Why do you want to study this concept or this topic? Next is subject matter or topic. What's the specific topic? Is it COVID related? Is it nursing? What? Place or local? What is in nursing? Is it nursing education, nursing practice, nursing research? Where? Where in um, this profession? Is it in nursing students? Is it for the nursing population? Period or time? When? Is it 5 years research? And last is the universe. Who will be your respondents? Is it nurses, teachers, or whomever? So these are the elements of your research problem. So the research criteria or the criteria for research problem is first is problem criteria. Is it significant? Most important criterion. So as you are doing your literature research, you're browsing the web, you should always place on top of your head, is this topic can contribute to the profession? Is it significant to me? Researchability. A problem of moral or ethical nature may not be amenable to scientific investigation. Yes. Is it researchable? Such as having a research that has a higher increase of death or mortality. It's not researchable because it entails a higher risk. Okay? Feasibility, a problem that's significant and researchable may not necessarily be feasible. Later, we'll discuss feasibility. Research criteria. So, it's based on education, training, and experience. So, based on the researcher's capacity and capability and background of research. Researcher support comes from various sources. Without support, the study may not be feasible, such as if it's nationwide research, should have a budget, should have allocated for having dissemination of your questionnaires, and even doing some of giving of some tokens to your subjects or your respondents. And ethical consideration is very important in creating a research problem because some of the subject's safety and well-being study will be terminated if this will be cause undue distress, injury, disability, or even death. The four important consideration research problem selection. So again, the four elements or consideration: significance of the problem, feasibility, researchability, and the research interest. Is the problem an important one? Will patient and nurse or the broader healthcare community benefit from the evidence that we produce? Will the result lead to practical application? Will the problem challenge untested assumption? And will the study help to formulate or alter nursing practice? These are the questions should be asked before creating a research problem. Not all problems are amenable for research inquiry. The data are available and accessible. The data meets the standard of accuracy, objectivity, and verifiability. Answer to specific question can be found. Hypotheses formulated are testable. Equipment, instruments of research are available and can give reliable results. Feasibility, there should have enough time and timing, availability of study participants, and cooperation of other stakeholders. Additional to feasibility, there should be facilities and equipment, money, and the researcher experience. In the facilities and equipment, you should have, if it's qualitative, you should have recorder, cam recorder, video recorder, and in the quantity or qualitative, you should have some of the researchers so complex that needs uh, the the expertise of our system, the software, for us to further analyze your data. So money, again, you should have enough budget for us to sustain the research. If it's regional, national, or global research, should have funding because it entails every step of the research entails cost. From manpower, your research assistants, your having expert reviewed, ethical uh, review board clearance. So all of that entails cost. And last is the researcher experience. If you're not confident enough to do a complex methodology, you should seek guidance to an expert. So please, 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 you should be guided accordingly. Research interest is very crucial because genuine interest in and curiosity about the chosen research problem are critical prerequisite to the success of the study. Why? Because the different phases of research is painstaking. Thus, if your motivation is that deep and you are rooted for your identified significance of the study, and you have that dream or your goal to add additional knowledge to our profession, this is very important. You should have interest with the subject. Determination of study purpose, the purpose of the study. So there should be justification, reason, motivation, or the rationale of the study by presenting its overall objectives and goals, such as SMART. So it should be specific, measurable, attainable, realistic, and time-bound. So your objective should be based on the 5 characteristics. Good statement purpose in quantitative studies indicates independent for the cause or the causal factors, dependent variable, the effect, and the population study. Example, the study aims to determine the level of awareness of teenage mothers on newborn screening test. This study seeks to determine whether viewing video of the actual unang yakap can increase the participation of pregnant women in the delivery room. So our independent variable is the newborn screening, the dependent variable is the level of awareness, and our population is teenage mothers. Independent variable is viewing a video of Unang Yakap. The dependent variable is increased participation, and population is the human. So, how to write research title? Generally, the title is formulated before the start of the research work. It may be revised and refined later if there is a need. The title must contain the subject matter of the study, the locale of the study, the population involved, the period when the data gathered or will be gathered. It must be broad enough to include all aspects of the subject matter studied or to be studied. Hence, the title indicates what's expected to be found inside the thesis report. It must be brief and concise. Avoid using terms as analysis or study. Remove that. All things are understood to have been done or done when research concluded. If the title contains more than one line, it must be written in inverted pyramid. All words in capital letters. Okay, now, are you ready for our step 2? Our step 1 is our research problem, our research title. Now, let's do review of related literature. Why we are doing review of related literature? Because this review of related literature are written summary of the existing knowledge based on research problem obtained from non-research reference and research reference. Considers primary and secondary source. Include a statement indicating what present study will add to what's already known. One of the most important steps in research. Why review of related literature is very important? For us to know what are the other researches, not only here in the Philippines, but across the globe. Because it may add, or you may, no? You may challenge the other researches based on your results. Purpose of related literature. What are the purpose? Acquire skills of critiquing, which increase the comfortability with the research process. So as a researcher, as a budding researcher, you should have that eye. Okay, you should have that eye of a researcher. You can see the flaws of other researchers. So you can critique, other researchers, and you can see how they do it, and for you to be confident enough to coming up your own research study or research project. You will have confidence about doing research because you have back up research or evidences. Become familiar by current knowledge because in doing your review of related literature, it should be 5 years. It should be 5 years from now. Last 5 years. So it should be 2015 to 2020 only. Okay, the year of publication. Types of and sources of literature. We have empirical and we have non-empirical. So empirical, it's more on the printed, found in books, encyclopedias, professional journals, and magazines, newspapers. In non-empirical, it's anecdotal recordings, opinion articles, and reports or case reports. Empirical is divided also into two. We have the primary source. The primary source is its description of studies written by the researcher who conducted them. The secondary source is description of studies prepared by someone other than the original researcher. Okay, so let's proceed. Factors in doing literature review. First is the nature of document to be prepared. Is it major determinant of extensiveness of the written review? So the nature of document to be prepared. So it is more on we do research first from the global perspective until if you can reach to your city level, so that's very fine or very good for you to have comparison of analysis and topic or subject of the review. So in the literature search, you should be specific, no? Should be specific. If your research tends to have a pediatric patient, what specific age group or age in pedia, no? So relevance and quality of literature with respect to the demands of the new study. Key criteria for inclusion of references in a written review of literature. No? Major steps in doing literature. First is locating relevant literature. So I suggest you conduct your literature review in a reputable journal, no? And the journal of the from the universities and colleges. Abstracting and recording of information, critiquing, evaluating the evidences, preparing a written literature review. Taking clinical fieldwork provides perspective on recent clinical trends, current diagnostic procedures, and relevant healthcare models. So step 4 is defining the framework, developing conceptual definition. Most basic irreducible term in research to refer a phenomenon that is known to be true. Fact is the building block of concept. Concepts are, however, refers to things that and their properties. A mental idea may be concrete or abstract, building blocks of a theory. Conceptual framework is utilized to specific and well-defined concepts and constructs that describes ideas, plans, design, and strategies. A construct, however, is a highly abstract phenomenon, and a theory is a set of statements that attempts to explain or define the relationship between certain group of concept or preposition. Abstract generalization that offers systematic explanation about how phenomena are interrelated. Types of theory. It's discussed already in your theoretical foundation of nursing. Let's review. We have the grand theory, articulates a broad range of significant relationship among concept or discipline. A mid-level theory focuses on exploration of concepts such as pain, learning, and self-esteem. Critical theory elucidates how social structure affect a wide variety of human experience. Theoretical framework is an overall conceptual underpinning of a study, broad general explanation of the relationship between concept of interest of a research study, term and relationship that clarifies the problem of the research and within which the problem is formulated and solved. However, conceptual paradigm is a shared understanding and assumptions about the reality of the world, a visual pattern, a diagram that represents the underlying theory with all its structure and parts, principles, and concept of particular study, visual grammatical picture, the study variables and their relationship and interrelations. Assumptions are the basic proposition that's taken to be true, based on logic or reason, no proof of verification, positive assertions of or the statements that serve as starting point which study proceeds. There are different types of assumption. We have the universal assumption. The researcher's knowledge from observed facts related to the problem and are presumed true based on experience and observation. Example, smoking is harmful to one's health. Hand washing prevents infectious diseases. Study assumption is based on positive assertions necessary to carry out the study, serve as starting point from which the study proceeds, and serve as basis for starting the study hypothesis. Example, maternal attitudes and behavior affects toilet training of toddlers. Position during labor influences the progress of labor. patient faces surgery has fears and anxiety. Theory or research-based assumptions. These are assumptions or premise on the specific theory applicable to the study. May come researches that needs further validation. Example, patients' basic physiologic needs must first be met before providing client teaching. Based on Maslow's hierarchy of needs, perceived susceptibility to a certain disease or condition influences behavior change. Okay, let's proceed. In research, you should have study scope, delimitation, and limitation. Delimitation is the characteristics that limit the scope of the investigation. Determine the researcher's conscious inclusionary and exclusionary decisions. Such as in my study, light in the midst of darkness, lived experiences of cancer patients. My delimitation is cancer patients in pedia ages, so from 0 to 18 years old. So that's my delimitation. And currently having a alternative treatment or medical or other alternative treatments such as chemo, radiation, or combined. So that's my delimitation. My limitation is the analysis because it's qualitative. It's not to be generalized by other cancer patients. It's only limited on the premise of pediatric cancer and with the specific situation. Okay, so formulation of hypothesis. Hypothesis is smart guess, no? So research hypothesis, we have prediction or testable statement about relationship between two or more variables, which our research aims to test if it's supported or rejected. A prediction about the relationship between two or more variables. The hypothesis is tested, and if found to be true, accepted or it's rejected. Formal declarative statement of expected relationship between variables are being tested. Hypothesis is the predicted answer to queries. Example, does a sexual abuse childhood affects the behavior of child when he grow up? Eating junk foods is a predictor of being obese. So, research hypothesis is a declarative and it predicts, no? There's a relationship between the woman's walking during labor and duration of first stage of labor. Other examples, there is a relationship between the place of delivery and the development of infection. Other example, there is a relationship between the age of the client and the risk of developing infection. So there's research hypothesis, there's null hypothesis. There's no relationship between the independent variable, hypothesis of no difference, and states that there's no difference or correlation in the scores of the population of the study, such as there's a relationship between women's walking, there's no relationship, and there's no relationship between the age of the client and the risk of developing infection. So we have the comparative. So we have done this. Research hypothesis is more on the relationship. Okay, greater, lesser. Hypothesis may be a simple or univariate hypothesis. There's only one independent variable and one dependent variable. So nurse with more work experience is the independent variable, provide better care. So that's the dependent variable. The nurses with less experience. So complex or multivariate. So predicts relationship between two or more independent or two or more dependent variables, such as nurses with higher educational attainment, that's the independent variable 1, and more work experience, the independent variable 2, provide better care than nurse with lower educational attainment and less work assignment. So we have different, uh, we have a lot of independent variable and dependent variable. So we have hypothesis may be directional. Hypothesis clearly specify the direction, specifies not only the existence, but also expected direction of the relationship between variables. So example, older people are at greater risk of acquiring influenza than younger people. So there's direction. If from the first variable to other variable, if there's increasing, there's also increasing trend, no, on the other variable. The older the person, the greater risk that he or she will acquire influenza. So the non-directional hypothesis do not clearly stipulate the direction. Example, there's a relationship between the age of a person and the risk of acquiring influenza. Older people differ from younger ones with respect to the risk of acquiring influenza. Not like in the directional hypothesis, you use the greater, lesser. So here, non-directional hypothesis, it is more on generalized. You're not predicting ano, anything. Research variable refers to varying characteristics, properties, qualities of people, things, phenomenon, situation, events, or condition under the investigation, which can be quantitatively or qualitatively assessed. These the kinds of research variable are the independent variable, it's the presumed cause, or the stimulus of phenomenon under investigation. Dependent variable, however, is the presumed effect or the response to the causal phenomenon under investigation. Continuous variable is one that takes on a wide range of values between 2 points and that can be presented infinitely in a continuum, such as grade or percentage. Discrete variable, however, are small range of values or finite number of values between any 2 points. So like sampling, so you have only 10 respondents, so that's discrete variable, or number of children, 2 boys, 3 girls, that's very definite. Discrete variable is subcategorized by categorical variable. It is more on the socioeconomic status. Is it low income, middle income, blood type, if you are A, B, O, A, B. Dichotomous variable, only 2 values, male, female, true or false. Answers yes or no. Definition of terms have in research we have two, in the conceptual definition and operational definition. Please bear in mind that conceptual definition is based on literature, based on references. And operation definition is how you use the word in your research, such as cancer warriors. Cancer warriors, as defined by the researcher, is a person who had recovered from cancer. So that's an operational definition.